Senator Whitehouse.
Thanks, Chairman. And as I think I've done in each one of these hearings, let me thank you and Ranking Member Murray for the bipartisan way in which this has proceeded and what I think has been an optimistic launch platform this has made for good work going forward. I wanted just to check in with Ms. Postolowski. As I understood your testimony, your dissatisfaction with the Colorado high-risk pool that you were put into had to do with the waiting period that you were subjected to and with the cost of the premium. Is that a fair description of what you said?
That's correct.
So you were here when Senator Kaine talked about the prospect of, say, a Medicare program that somebody could buy into at a reasonable rate. Would you have the same hesitation about that? Or would you feel comfortable going into a Medicare for people who had diseases as opposed to Medicare for people who are over a certain age?
I certainly think a public option that has a robust risk pool would be the most attractive option, both for taxpayers and consumers. The idea of buying into a public option is not something I would be opposed to, though.
As the co-author with Sherrod Brown of the public option that we nearly got into the Affordable Care Act, I appreciate you saying that. We came very close. We missed by a very small margin of votes. And I think had we succeeded, we would not be having the competition problem and the Bexar County's problem that we are facing right now. But this is Congress, and you have to have the votes. And we were close, but no cigar. Mr. Farmer, I wanted to ask you a question. I was the state insurance commissioner for a while in Rhode Island as well. And in the health insurance market, I wanted to get your comment on if a health insurance provider was to come and propose to do business in either your state or, speaking for the National Association of Insurance Commissioners more generally, how important would it be for that insurer to show that they had a robust and legitimate provider network in your state?
Thank you, Senator. First, we welcome competition in our state, and no regulator would say anything different.
Correct.
It's important for that new provider or that provider to have a workable and extensive provider network. You know, the Affordable Care Act in some instances has produced more narrow networks. We've got to get beyond that. You know, we've...
But an insurance company that was proposing to do business in your state and had made no effort to establish a network of doctors and hospitals, a provider network, would be viewed with disfavor, correct?
That company's not going to do business in our state.
And that would be true for most or all insurance commissioners as well?
They'd have to speak for themselves, but I doubt anyone would. You know, if you're not going to come in and provide the basic services and the networks that you're there to do, you're going to have issues. Yeah. I don't care what state you're in.
So let me ask all of you, if you wouldn't mind, a question for the record. It's the same question that I have asked all of the witnesses, all the panels so far. Many witnesses have urged, and the chairman has expressed interest in continuing this bipartisan conversation beyond just market stability and going into the areas of cost and quality of care that I think provide immense bipartisan opportunities. There are 5 that I have asked people to focus on. One is patient safety, hospital-acquired infections, that arena of concern. It is a very significant cost of casualties among the American public. The second is learning from the variations in cost and outcomes that show themselves among different states and using those differences to learn what best practices are. The third is trying to reduce administrative overhead. One of my particular favorites is the warfare between insurance companies trying to deny payment to providers and providers having to staff up to try to fight their way through that barrier, and the whole enterprise contributing 0 healthcare value, and it's just ridiculous administrative bureaucratic warfare that we all have to pay for. The fourth is making sure that people's wishes as to what care they will receive at the end of life are properly documented early on so that they can be honored when it's game day and things are going badly. And the final one is looking at payment reform as an opportunity to redirect care so that doctors have the incentive to intervene earlier in the process with prevention and so forth, and not be condemned to receive no compensation unless and until somebody is sick enough to require a procedure or a prescription. So if you'd all be kind enough to respond on those fronts, what you think our opportunities are here for bipartisan action in this commission, I'd be grateful to you, and I'm grateful to the chairman and the ranking member.
Thank you, Senator